Hello, everyone. Hello, my name's Susan Cole,
And Matthew Hodson.
and welcome to aidsmapCHAT, our weekly show where we'll be chatting to guests from around the world about issues around HIV and COVID.
Yep, and we're live. I've just forwarded the link to this on Twitter. We're also on Facebook. We've got some fabulous guests lined up for us this week. We've got Lloyd Russell-Moyle, who was the first UK MP to disclose his HIV status in a parliamentary speech. We've got Kevin Fenton, who is the head of the regional director of Public Health England for London. He's just taken up the post, and can you imagine what it must have been like to take up a public health role at this particular moment? And we also have the beautiful story that is Doreen Moraa Moracha, who battles HIV stigma in Kenya.
Wonderful. And how has your week been, Matthew? How are things going?
It's been an absolute nightmare. I've hated every second of it. How about you?
Well, I just found out today some very important news. KFC has opened in Croydon. So
Well,
for delivery.
so what is it about you? Every week you just like to talk about fast food outlets. I mean,
Well, I'm a South London girl, and fast food is very important for us. So fingers crossed,
well,
McDonald's will
well,
be following
if we're
soon.
talking about that, then I'm just going to give a shout out to my friend Brad, who's a baker, and he's just delivered some pizza dough for us. So I will be cooking my own pizzas tonight.
Um, Fantastic. But if we could park fast food for a
Yeah.
moment. I
Yes.
could talk about fast food for a long time. So have there been any stories in the news around COVID and HIV that have struck you recently?
Well, I mean, the really big story that we've just reported on aidsmap is this new modelling, which is looking at what predict the excess mortality will be as a result of COVID. And I mean, obviously, this is mathematical modelling, so it's not saying that this is a prediction. It's just saying that this is what we think is going to happen if X, Y, and Z happen. Um, and it's devastating. We are looking at an additional 550,000 deaths from HIV in sub-Saharan Africa this year. So I mean that's double what we would have expected otherwise.
Oh yeah, that's
And
awful.
yeah, and this disruption is going to last. According to this model, it will probably last for 5 years. We're going to see excess mortality. And that is obviously not even including the kind of mortality we're going to see as a result of tuberculosis or as a result of malaria. Um, and we talk about this a lot. I mean, it often comes up in these aidsmap chats, but it it's not just the deaths that we will see as a result of COVID-19. It is the deaths that we will see as a result of people not being able to access their HIV treatment. And also, with people not being able to access their HIV treatment, it also means that people will continue to be a transmission risk to sexual partners. And so, as well as the excess deaths that we will see, we will also see a larger increase in new infections than we might have otherwise expected.
Yes, that's absolutely awful. And what really struck me about the data as well was the potential huge increase in mother-to-child transmission of HIV. I mean, we've I think one of the really big success stories has been the significant reduction, and this modelling data has shown that there could be an increase by 104%, which
Yeah.
is absolutely staggering. And I think it's so important that we do everything that we can to fight COVID, but I think it's really important that that isn't at the expense of battling other diseases. And I think HIV potentially could be a victim here.
Yeah. I mean, and well, I mean, again, we talk about the impacts of COVID, and it's always the most marginalized in society who suffer most when there's a pandemic on. Um, and I've also been really disturbed by some of the reports I've been seeing about what's happening to LGBT communities around the world. Um, I mean, South Korea, which has actually had an incredibly effective COVID response, but a part of that is a very conservative society, and gay men have been outed and shamed. We've seen there was a video footage of an LGBT refuge in Uganda being raided, and 18 men have been imprisoned. Trans women have been beaten by police in Georgia, and trans rights have been eroded in Hungary and Puerto Rico. Obviously, for LGBT communities, we have a history of, you know, for myself, I was around in the 1980s. I was coming to terms with my sexuality in the 1980s. And in the UK, we saw new homophobic legislation introduced, supposedly. I mean, there was no mention of HIV or AIDS within that legislation, but it was all about protecting children, and there was a real undercurrent of protecting children from disease. And we see, when we are facing a crisis like this, that it's those people who are often most marginalized in society who bear the full brunt of it. So as a queer person myself, I mean, my heart is breaking for people, and and it's a global challenge, this.
Oh,
So,
that
yeah. I told you it's been a bit of a rubbish week, really, hasn't it? There's not much I'm celebrating there. I'm sorry, I don't have a KFC opening up
you don't.
soon.
Well, I think it's probably time to then bring on one of my heroes, to sort of lift the
So
mood.
I'm not your hero? Okay.
Welcome, Lloyd Russell-Moyle MP in sunny Brighton.
Yeah, we've got blue skies, so.
Excellent. Lloyd, you came out about your HIV status in a really public way. The first MP to talk openly about living with HIV in a parliamentary speech. What was that like for you?
Well, it was nerve-wracking, of course, and you're always a bit worried that people are going to take it badly. People actually were extremely kind, apart from a few people phoning up and saying horrible things down the phone. But to tell you the truth, as a politician, you get that whether you talk about your HIV status or not. But actually, my colleagues in Parliament and my constituents were very good and supportive about it. But I did it probably for three reasons. One is because I wanted to just get it off my chest, and actually you walk lighter when you just know that it's not an issue. But secondly, because I was worried that we were losing focus, particularly around some of the developments around PrEP that we needed to push. And then finally, in Britain, there'd been so much cuts to public health and particularly sexual health that I just felt it was important to raise these issues. As a politician, you have to use real life examples to raise political ones, and sometimes by raising real life examples, you raise personal ones.
Yeah, I've definitely found that being open about my HIV status has really helped me. It's actually, I mean, I've just found it really empowering, because before there was always that element of, well, what if people find out, and will people judge me in a different way? And your my own self stigma kind of fed into that.
Yeah.
And then as soon as you're just like, oh, everyone knows now.
And rather than having to think, or do I need to tell this person or not? The burden, to some extent, particularly with me, the burden is on the other person. I mean, been on all the national papers about it. If they don't know, well, actually, where have they been? And they need to care more about my life. And I don't need to think, is this the right person to tell or not? It's a case of, well, if they care, they'll know.
Absolutely. It makes us stronger. Stronger.
I mean, we've had huge progress in terms of HIV. Certainly in the UK, we're really fortunate in terms of having access to treatment, and treatment has been around for many years. But unfortunately, there's still lots of people worldwide who don't have access to treatment. And do you have concerns that we're going to see that when and if a COVID vaccine is made available?
Yes, I mean, we still have to say if a COVID vaccine is made available. I mean, you think how long it's taken, and we are close, but still not there, to get a HIV vaccine. I think we will probably get one because the amount of money that's ploughed into it. And I think that's also something to think about if those resources had been ploughed into other diseases, where would we have been? You know, how far could we have got? But it's not just about HIV. If you look at vaccine take up around the world, apart from 2 diseases, we have never managed to eradicate diseases so far. And that is because it is really difficult. Vaccines are expensive and they're difficult to get to the right people and the right places at the right time. And there's a real danger that if this vaccine is not made free or extremely cheap, it will just not get to the right people. Already we have the Gavi system, which is a system to try and bulk purchase vaccines to get the price really down. And that still excludes many people from being able to get access to it.
Yeah. And I mean, I think with COVID, I mean, obviously it's a global pandemic. And unless we actually find a solution which is going to work on a global level, we're never going to conquer it.
Yeah.
So, you know, it's really important that nations come together and work together on this, and that everyone, you know, no matter where they are, it should be available to all. I think it's I'm really, it feels like such an opportunity for nations to work together here, and I'm really terrified it will be lost.
I'm a silver lining guy. I like to think about what could the good that come out of it. And I remember 3 years ago, I've spent a few weeks in Liberia to look at some of the post-Ebola stuff and how actually we'd used that, not as effectively as I'd have liked to, but able to use that, particularly with TB treatment and some HIV treatments as well, to be able to get a community health response. So you had community health workers in communities, and once they're in there, you're able to get them to do a number of things. So if we have a global response to get the vaccine to everyone, that means you've built a network that can also start to deliver other forms of health interventions. The danger is at the moment we have a kind of shut down everything approach. You know, don't go out, don't go. And what that's doing is actually destroying health networks that might be very fragile. And so we need to make sure that we take the advantage situation, the silver lining situation, rather than the dark clouds of the situation.
Let's go for the silver lining approach.
Yeah.
Lloyd, it's been so fantastic to talk to you, and I'm really annoyed because you are the Shadow Minister for Air Quality, and air quality is like really, it seems to be linked, but unfortunately, I don't think we have time to discuss that right now. So we'll have you on the show again, I hope.
Yeah.
Wonderful. Thank you, Lloyd. Bye.
Ah, dear. Yeah. So I mean, there have obviously been some kind of progress made, because it looks like we're about to get antibody testing in the UK.
Yes, and I think Public Health England have said that there potentially is one that's going to work. If only we had someone from Public Health England.
If only, you know what? Why don't we get Kevin Fenton, who is the regional director for Public Health England in London? There he is. It's amazing.
Wow.
I mean,
hi, Matthew.
That was the smoothest segue in history. No one noticed. So, Kevin, you were literally last month, you took up the appointment as regional director of Public Health England for London, which has the highest prevalence of COVID in the UK. Is that right?
So regionally, we have nearly 26,000 cases in London, and unfortunately, just over 5,500 deaths. So the epidemic itself has certainly taken its toll on Londoners. And as you know from the data that are coming out more recently, we're beginning to see the impact of COVID on Black and minority ethnic communities, on men, especially on more deprived communities in the cities. So not only have we had a severe epidemic experience with the epidemic, but we also know that its impact on inequalities has been of great concern.
Mm-hmm.
So, I mean, yeah, I'm sorry. What's PHG doing to address those inequalities, particularly for BME communities?
So we've been asked by the Chief Medical Officer, Matthew, to really look at the research and surveillance data that we have to really understand whether there is disproportionality across the ethnic groups on your likelihood of being tested for COVID, your likelihood of being diagnosed with COVID, your progression to severe disease, as well as your likelihood of dying from COVID. And we're looking at the variations across racial and ethnic groups. We're also looking at other differences by age, by gender, and of course, region across the country. So we'll be able to get a deeper understanding of these variations. And from that, we'll be able to understand how best to intervene and to support communities across the country as we respond to COVID. And as we move beyond the peak of the epidemic and we're looking at sort of low levels of transmission of COVID within the community, how best to support communities to reduce risk. So a really important work. And I think a lot of what we've learned from HIV will be particularly important here in helping us to engage communities, address stigma, and really help to keep the focus on prevention.
Wonderful. I mean, as a Black Londoner myself, I know people in my community are really scared at the moment. What advice can you give to people who are worried at the moment while we wait for the answers and wait for the data?
Well, Susanna, you're absolutely right. And in fact, a part of Public Health England's work is undertaking a major engagement and listening session. And I've been speaking, a listening exercise, and I've been speaking with so many community representatives, professional organizations, academics across the country to understand what they're seeing, what they're hearing, what they're feeling about the impact of COVID on minority communities. And this concept of fear and distress and grieving about what's been happening is very real. So I think there are things that we can do. First of all, ensuring that our communities have the materials that they need to understand what they can do to protect themselves and their loved ones. That we really, because we see this strong association with severe COVID, with factors such as smoking and obesity and poorly controlled long-term conditions like diabetes and hypertension, there's a chance for us to really focus on supporting communities to take more control of their health so that they can protect themselves from severe COVID and death. So there are things that we can all do to protect ourselves. And of course, ensuring that we are isolating and following government guidelines as well. Really important that we don't take our focus off of the things that we need to do as communities to protect ourselves.
Yeah, I mean, you talked about the emotional impact, and I mean, already we're kind of getting at the moment quite anecdotal data that I've seen around, you know, kind of increases in suicide, and certainly much more calls on kind of counselling services and other mental health services. Now, for you as you know, representing Public Health England, I mean, how do you balance out the physical health of Londoners with their emotional health? Because, you know, some of the measures which we're introducing to tackle COVID are also having an emotional health impact.
Well, you're so right, Matthew, and I'm so glad you raised this issue of mental health, because when I think of the health of Londoners, it's about combining and integrating mental and physical health as one. And the impact of COVID certainly is not just on the physical health and well-being. We know that the impact of the lockdown, social isolation, the fact that people have not been engaging with health services has meant that the stress and anxiety levels are up and people are struggling as we go through this phase of the epidemic. And we expect as we move into the next phase that we're likely to see a lot of mental health issues appearing. And so we've been really focusing in London with the Thrive London initiative to really engage communities and provide more online preventive services and support services for mental health. And the NHS has been fantastic in thinking about pathways for diagnosis and care and support for people who may be struggling or who may have a pre-existing mental health issue that need more intensive support. So this is really at the forefront of leadership and healthcare leadership in London about protecting both physical and mental health.
Yeah, it's so important. I mean, I guess one of the things that's been really getting to me this week is I've been thinking more about how long we may be restricted in our movements. I was talking to a friend of mine who is from Canada, and the kind of the realization she has that she doesn't know when she'll see her family next, and it may well not be this year. She may not be able to get home to see her family this year, and the toll that's going to extract on people, it's immense.
Yeah, it really is. And so therefore this concept of, you know, living with COVID, and, you know, we sometimes speak about life after COVID. The reality is for the foreseeable future, for the next year, 18 months, even when a vaccine is available, it will take time for the vaccine to reach the entire population and to be scaled up. So we really are looking at the next 18 months to 2 years of actually living with COVID and having to adjust how we interact with each other, how we use public spaces, how we interact with the workplace, and how we do daily activities in London. And I think now more than ever, conversations like this and the way we support each other moving forward is going to be critical, because none of us will be able to survive this on our own.
Yeah.
And if never before, I think this whole experience is highlighting the importance of community and what community is and the value of community and community support services. So I'm hoping that as we move into this next phase, conversations like this will continue in communities across the country and London to ensure that we're well prepared for the next phase.
Oh, thank
Wonderful.
you so much, Kevin. Thank you.
That's wonderful. Thank you. Hopefully see you soon.
It is that thing, isn't it? We hear, within all this horror, we hear these wonderful stories about how communities are responding, across the UK, across sub-Saharan African nations. I mean, every day I hear something which actually does fill me with joy about that response and how people are helping each other and supporting each other. And we need that so much at a time like this.
Absolutely. And that seems like a segue to bring in, if only we had a guest who was a ray of sunshine.
Oh my God, the sun's just come out. It is. It's Doreen Moraa Moracha. How are you, Doreen?
I'm fine. How are you?
Yeah, we're good.
All the better for seeing you.
Absolutely. Doreen,
I'm also fine.
It's so wonderful to have you on. I mean, you have been so inspirational to people all around the world. You've taken the cards that life has dealt you and created a beautiful story that's helped so many people. So thank you for that. But how have you been coping with the challenges that COVID has been bringing people living with HIV?
Well, at first I was worried, especially with the fact that they said a lot of people who are immunodepressed have an issue, and they might have a chance of getting of getting COVID-19. But then I realized that we managed HIV and AIDS from a death sentence. We managed it from a deadly pandemic, and now it is just a normal health condition. So I believe that one day we're just going to look back at COVID-19 and say, oh, we did it. We did it. It was a test and we passed it too.
Oh, I hope so. I do hope so. Now, Doreen, because you were diagnosed at a very young age. How old were you when you were diagnosed with HIV?
I was 8 years old.
8 years old, and I because I follow you on Twitter and I see the energy and the optimism that you put out into the world, but also you talk about God, and you talk about God having had a purpose for you. How does your faith inform your approach to life?
Well, when today somebody asked me a very interesting question, that how come I lived with HIV for a whole 13 years without medication, and then I'm still here? They're like, you're not really living with HIV. So I told them, I also can't explain my story, and it can't make sense in the way you want it to make sense, because it's all about how God has planned it. And as much as I go through life believing that God is there, God has a purpose for me, I also believe that I have to take my ARVs every day. And the same purpose He had for me when He created me 28 years ago is the same purpose that He's going to have for me as we move on with life.
Wonderful. That's so inspirational. And I've heard you speak about the times when you found it difficult to take your medication and the impact that had. What advice would you give to other young people living with HIV who perhaps are feeling overwhelmed about taking their medication every day and might be considering stopping?
I stopped taking my ARVs for 2 years, as much as I have been on ARVs for 15 years now. And it is overwhelming. Treatment fatigue is so real. But one of the things I can tell you is also being undetectable is so beautiful. Like, you have this whole life ahead of you, and you're like, like you can do anything. It does not limit you. So stop giving HIV the power to define you. I always say HIV is a tiny virus. Don't give it power over your life. You are the guest, HIV is the host. So as the host, you are the host, HIV is the guest. So as the guest, as the host, you're making the decisions. You're calling the shots. You're telling it, you know what? I'm making you undetectable, and I'm never going to be in any hospital, lying on a hospital bed, because my life goes on. I am undetectable, which means I can transmit to anybody, and my life goes on.
Oh, fabulous,
Wonderful.
Doreen. Fantastic. Thank you so much for coming on. And really great.
you.
Always get the U equals U message out, because when we tell people that, it strikes at stigma, it encourages adherence to medication, it will help end the epidemic.
Wonderful.
It will. Thank you so much.
Thank you so much for coming on.
She is just when you meet people and they have this wonderful energy about them, don't you? And Doreen has that.
Yeah. She does, and like you, Matthew.
What? No, go away.
She really is truly inspirational, and I'm so glad that she, and which of course you are, Matthew. But I think the power of the U equals U message is so important. And I don't think we should lose sight of the fact, obviously it's incredibly important that people living with HIV, if they take their medication properly and they have an undetectable viral load, they can't pass it on. But ultimately, the most important thing about taking your medication is staying alive.
Yeah. Oh, absolutely. I take my medication to stay alive. Everything else is bonus. But I think one of the big challenges, if you have access to treatment, is the stigma that people who are living with HIV still face. And I do think that U equals U is an incredibly powerful tool in tackling stigma, because so much of the fear that people who don't have HIV have, or people who live with HIV, is, well, what if I get it from them? And so when you can say, look, we could do whatever and you won't get it from me, that's kind of good, isn't it? I mean,
that's brilliant. And
so now you need to banish that image from your mind.
Well, I think we are starting to run out of time. So, Matthew, who do we have on next week?
Well, next week we have Shannon Hayder, who is the Deputy Executive Director of UNAIDS. Wow. We have Winifred Ikalai from Uganda, who works with the AIDS Vaccine Advocacy Coalition. And we have an epidemiologist and assistant professor at Harvard Medical School, Julia Marcus, who has just written an incredible article about how we need to make harm reduction part of our lives in the COVID-19 era. So I'm really excited about all of those guests.
That's brilliant. So I really hope that everybody will be able to join us next week. Is that the 21st?
It is the 21st. And one thing we haven't said, which I think we need to say, is that next week is the last of our scheduled run of shows.
Oh
no! I know. Well, but it's been. I mean, next week obviously will be a complete disaster zone, and then I'll hate everything about it. But assuming that isn't the case, it's been really lovely. But what's been really great is when we kind of get feedback from people. So it'd be fantastic if you've enjoyed this show. Let us know. If you've hated this show, let Susan know. But your comments are kind of really helpful for us. So please do let us know, because we will be looking at it and kind of thinking about whether we're going to bring it back. But we need to take a break after next week.
And hopefully we will be coming back very soon. But do please join us next week, Thursday, 6 p.m. for aidsmapCHAT, and we will see you then.
See you then.
Bye.